Welcome to this lecture on professional reasoning in occupational therapy. In this lecture, I'm going to be discussing ethical reasoning and narrative reasoning. I will touch a little bit on professional reasoning versus clinical reasoning, and then we'll then move on to discuss the two types of reasoning, ethical reasoning and narrative reasoning. So looking at professional reasoning and clinical reasoning, how are they similar? Is it one and the same thing? Professional reasoning is the process used by practitioners to guide us when we engage in professional activities. It is the process that we use to plan, to direct, to perform, and to reflect on services that we have provided or that we provide to our clients. And our clients can be individuals, could be groups, could be communities, could be organizations, could be populations. Whereas clinical reasoning primarily focuses on the thought processes directly involved in patient care within medical settings or within medical contexts. It is about making decisions and taking actions related to assessment, intervention, and evaluation of our patients. So in contrast to the term clinical reasoning, professional reasoning, it broadens the focus to include reasoning that occurs in non-medical environments. So we know that occupational therapy is not only a clinical profession, but occupational therapists work in a whole lot of other settings that are non-clinical or non-medical. And they also use reasoning processes. And the reasoning that we'll be using in those settings is actually professional reasoning as opposed to clinical reasoning. Clinical reasoning, if you like, it can be part of professional reasoning, with professional reasoning being the broader reasoning that we use in different contexts. Reasoning that could be used by occupational therapists working in communities or in schools, or occupational therapists managing services, for example. It's not clinical reasoning that they are using, they're actually using professional reasoning. In education, I'm an educator. The reasoning that I use when I'm working with students is not clinical reasoning, it's professional reasoning in occupational therapy. So that's the difference between professional reasoning and clinical reasoning. Professional reasoning being the broader one. The first type of reasoning that I will discuss is ethical reasoning. So we have major types of reasoning. For example, ethical reasoning, pragmatic reasoning, narrative reasoning, scientific reasoning, interactive reasoning, and we also have other subtypes of reasoning, which I'll discuss in the second part of this lecture. But for ethical reasoning, it is about attempting to make a decision on what is the right thing to do. It's a type of reasoning directed towards analyzing an ethical dilemma and generating alternative solutions to make a decision on which course of action to follow. It is a systematic approach that we use in the face of a moral conflict to try and resolve a moral conflict or an ethical tension. Some of the examples of ethical tensions that have been documented in occupational therapy practice include the ones that I've listed here. Issues to do with client safety. When OTs are working with clients and their issues or their concerns about how safe the clients are as they are receiving occupational therapy services. Ethical tensions can also arise around working with clients or individuals who are vulnerable. If we look at the protected characteristics in the Equalities Act of 2010, you will identify that there are some groups of people who are considered to be vulnerable, like the elderly, people with disabilities. Those are sort of like vulnerable group, children. So there could be sometimes ethical tensions in terms of the decisions that we make when we are working with groups of vulnerable clients. There could be ethical tensions around resources, what resources are required in order to deliver optimum service as compared to the budget allocation available, for example, for for those resources that are required. Sometimes ethical tensions arise in OT practice as a result of interpersonal conflict between the team members, um, between the supervisor and the supervisees. So such tensions can create ethical dilemmas sometimes. It can also be about upholding ethical principles and values if there is a situation that is threatening upholding of ethical principles and values or professional standards. So ethical tensions can come from all these different possibilities. Now, looking at the processes involved in ethical reasoning, what guides ethical reasoning? There are three main areas where we get guidance in ethical reasoning. The first is the philosophy or the theories, and then we have the principles of ethics, and then we also have the codes. So for the theory, there are two main theories. We have the teleological theory and deontological theory. So the teleological theory, it's consequence focused. It's sometimes referred to as the greatest happiness principle. It looks at the greatest good for the greater number of people, as well as the greater balance of good over evil, so to speak. So that's the teleological theory. And then the other one that we have is the deontological theory. The deontological theory, this is a theory that mainly focuses on action. So it's action focused, focused on the responsibilities, focused on the rights, focused on the duties of the individuals concerned. It's also based on being a way of thinking or decision making that is guided by conscience. So deontological doesn't necessarily concern itself with the outcome of the decisions that we make, but it's concerned about the action focused decision making, and it's also guided by our conscience. So those are two main theories in ethical reasoning. And then for the principles, we do have autonomy. Autonomy, this is about allowing our service users or our clients that right for them to make their own decisions. Then there is also beneficency, looking at doing the good thing. Non-maleficence is about doing no harm. So the assessments that we are conducting, the interventions that we are providing, we need to make sure that they are not harmful to the service user. Not only physical harm, but also emotional or psychological harm needs to be considered. There's also this principle of justice, which relates to fairness. As we are working with service users, there is need to demonstrate that fairness. Justice can also be further divided into distributive justice, and other forms of justice. Then there is veracity. Veracity, this one mainly is about telling the truth. Sometimes the truth is not a comfortable thing to tell the service user. So it then requires the therapist to be flexible and to be creative in terms of how the ways in which how the truth can be conveyed to the service user. And then fidelity, the fidelity is about faithfulness. It's about being able to keep the promises that we make to our service users. And then obviously we also have our codes of ethics and professional standards. We have the HCPC one, the recent one for 2023. And then we also have the Royal College of OT standards, as well as the World Federation of OT standards. Now, in making ethical decisions, Doherty has proposed 6 steps. In fact, these steps have been around for quite some time. It's only that they have been revised in 2021. So the first one is about getting the story straight, getting the story correctly. And then the second one is then identifying the type of the ethical problems. What is the ethical tension at hand, what is the moral dilemma? And then the third step is to analyze the problems using those ethical principles that I've discussed before. And then step 4 is to then explore the possible alternatives and maybe their probable outcomes. And then step 5 is then taking the action to address the ethical tension or the moral dilemma. And then the last step, which is step 6, is about evaluating the process and the outcome. So usually when there are ethical issues and people are in courts of law where their ethical practice is being questioned, what the jury or the panel normally does is they look at the steps that were followed in making the decisions. Sometimes not so much about the outcome, but about the steps. So it's very important for us as OTs to be able to systematically make our decisions with clear steps supported by logical reasoning that is ethical, abiding by the ethical principles to make sure that we can defend or justify each and every decision that we make.